Does it sound impossible to see a 50% improvement in your chronic pain that you've been dealing with for 10 years in 2 weeks? If that's you, I just want to let you know it's not impossible. And the research actually shows that 70% of people have a condition that can see rapid change. Before I go into like how we find that, I just want to introduce myself. I'm Philip Mitchell. I'm one of the holistic physical therapists here at Mitchell Holistic Health. And one of the goals at Mitchell Holistic Health is we want to get to the root cause. And so part of what I'm going to explain is like, how do we get to the root cause, and what's one of those movement principles that we're talking about in this series that leads to great outcomes and helps us with these people who have had pain for 10, 15, 20 years. So before I go into what the directional preferences that we're going to talk about, I just want to give some examples, because honestly, like these are patients that we have in our clinic right now, and they're seeing great outcomes. So one person, low back pain for 10 years, on and off pain for 10 years. It finally got to the point where he couldn't deal with it. He's toward the end of his package, and he's probably 75 to 80% better. And there was one specific movement that helped him a lot. And, we found a directional preference with him. I can think of another person right now, hip pain for 8 years. One or two movements made a huge change for her. And now she's nearly pain-free and going back to stuff that she hadn't done in years. Another person, 15 years of shoulder pain, had gone to physical therapy on and off over the years, thinking that it was a shoulder problem the whole time. But what he didn't know is like he actually had a neck problem. And so, finding that directional preference for this person is what unlocked the shoulder pain that basically made him not fail at the treatment he was getting. So let's go into directional preference, because hopefully by now you're thinking like, I want to be one of those people. Like, I want to have a directional preference. And the good thing is there's a decent chance that you do. And honestly, even if you don't, we help a ton of people who don't have directional preferences who still get better, because we focus on the root cause and the whole person approach. But what we mean by directional preference is a lot of times when people have issues in their body, or they're having some type of musculoskeletal pain that they can't get over, it's coming from the fact that one of the joints in their body are stuck. And so when your joint is stuck and it's not moving well, that is called a derangement. So meaning, let's say in the low back, let's say the joints are slightly off. Until those joints start moving again in the proper direction or get unstuck, you're going to have this pain. And so what we're looking for on this first visit is we're looking for what direction does this joint like to move that makes the joint unstuck. So that's the really short answer. And it differs for every joint. Like we see different patterns in the neck than for the back. But the great thing is the body is fairly predictable in patterns that it shows. And so, one of the things about coming in for a physical therapy appointment is like you're gaining our knowledge of like seeing hundreds and hundreds, maybe probably thousands of people with these conditions. And so we quickly pick up on a pattern and be like, oh, I bet they need this movement. And most of the time we're right, just because the last 10 people who came in with those symptoms needed that movement. So what we talked about with directional preferences, we got to find that certain direction that your joint likes to move. The other concept that I want to talk about is called centralization. This sort of goes along with directional preference, but it's a little different. So centralization is basically, let's say you have nerve pain. When you're doing let's say you're doing a back movement, the pain should leave your leg and come up toward your back. So it's centralizing pain. You'll see that in the neck all the time, where you're having like numbness and tingling down the arm, and you're doing an exercise, and then your pain goes to the elbow, and then it goes to the shoulder, and then it completely leaves the arm and moves toward your neck. That is what we call a direction, or that's what we call that's called centralization. But their directional preference would be whatever movement that made the symptoms centralize out of the arm or out of the leg. Another thing that will happen is you'll see symptoms sort of localize. Let's say let's say your elbow is stuck and you can't move your elbow a certain direction. So let's say you're getting pain that goes halfway down the forearm. If you find a directional preference in the elbow, you might see that the pain starts to localize more toward the elbow instead of down in the forearm, and then the pain goes away. So that's what we're talking about with the term directional preference and centralization. And what the research says about these, if you can find this on the first 3 visits, then you can pretty much guarantee that patient, not only can I help you, but you're going to start seeing rapid improvement, meaning 50% within the first 2 to 3 weeks of doing this. So for people who've been dealing with pain for a long time, it really does sound impossible that you could see this. but it happens so much that it's not. Honestly, uh, I've come to expect to find these in a lot of people. So what I want to do is I want to give you 3 exercises for different types of conditions, regardless of what you have. And then just 5 minutes a day, do these exercises, sort of pick out, if you have a headache, go with my headache stretch and do it 5 minutes a day. And just see over the first few weeks, how you feel with it. So I'm going to give 3 examples. The first one is headaches that are coming from the upper part of the neck. So a lot of these people will have, pain that starts in the base of their skull, and then it radiates up, but you're also going to see, tightness in the neck muscles, maybe restriction in looking up and down or turning your head. And so what that stretch looks like is I'm going to sit in a chair here. So the headache stretch is you want to bring your chin down toward your throat and pull your hands. Just pull forward while you tuck your chin up and back. Just like that. So if you're looking from the side, it looks like this. So you can see this nice stretch. So this joint is being put into flexion, but you're also stretching all these muscles that cause a lot of headaches to go up into the head. So with that stretch, I would try to do it for 30 seconds to a minute. If you see good relief with it, continue until either the headache goes away or you see significant improvement. But I would do this stretch like 5 or 6 times a day. Okay. The next example is I want to talk about the shoulder. I want to talk about that person who maybe doesn't have a rotator cuff tear because they don't have a lot of weakness in their shoulder, but they're still having a lot of pain in the front part of the shoulder, and they feel like their shoulder's almost getting stuck when they're trying to like lift their arm up. So one of the best stretches that you can do for the shoulder when you sort of have this anterior shoulder pain and it is pretty localized to the joint is work on restoring extension in your shoulder. Okay, so you do 10 of these. You can even use a table, like put your hand on the table and then squat down and try to go further into extension with that. But I would start with just like doing it in the air, just straight back. Push into the pain a little bit, but what you should see, if this is a good movement for you, is your pain starts going down as you do it, and then check your baselines. Check like how does reaching above your head feel. If it feels better, then this is definitely a good stretch for you. So the last one is that person who has shoulder blade pain, because this is so common, and it's honestly one of the ones that's missed a lot of times when they come in for physical therapy. So what this one is so let's say you come in with pain under the right shoulder blade or left, it really doesn't matter. This is usually caused by the joints in the lower part of the neck right here. And so the exercise for this, and I know I mentioned this in the last video, but doing a chin tuck, but then I want you to let your head fall all the way back. Just like that. Okay? So a full tuck, and then let the head fall all the way back. Okay? A good response is obviously you want to see the pain go down and you want to see your motion improve. So what you might see with this is if this is your directional preference, you might see that your shoulder blade pain, it starts leaving your shoulder blade and it starts moving to the neck. If that's what happens with this, then that is a fantastic outcome. Keep it up for a week or two, and I almost guarantee you that you will see a big improvement. So I hope you learned something from the directional preference and centralization. I love talking about this stuff because this is one of those things that like lights people up when they have hope, knowing like you're saying I have a directional preference, and I'm like, yeah, and knowing that that's going to be quick improvement, compliance goes up, you can see their attitude change right away, and I hope that's you. So for the next 2 weeks, I want 5 minutes a day, do your exercises. And once again, if this doesn't help, you might need a little bit more of a personalized approach. Feel free to call our clinic if you think you need a more personalized approach and get in for a physical therapy evaluation, and hopefully we can get you the answers you're looking for.